The Health Department has developed national guidelines for the management of viral hepatitis as part of efforts to reduce morbidity and mortality in the country. This as the global community observes the World Hepatitis Day to raise and increase awareness of the preventable and manageable disease. Viral hepatitis is the second leading infectious cause of death globally, including over 2,000 deaths in South Africa. Hepatitis is called a silent infection because most people do not have any symptoms when they are first infected. Symptoms may include fever, loss of appetite, diarrhea, nausea, abdominal discomfort, and dark-colored urine, amongst others. And for more on this, we're now joined by Head of Center for Vaccines and Immunology at NICD, Dr. Nishi Prabdial-Sing, and she joins us now via our video link. And Dr. Nishi, thank you so much for your time this evening. And apologies if I mispronounced your surname there. Of course, today, as we observe World Hepatitis Day, the theme being time for action, perhaps just take us through, just to remind our viewers what actually hepatitis is.
Good morning, good evening to all the viewers, and thank you for having me. So viral hepatitis can be caused by several viruses, and they are labeled as hepatitis A, hepatitis B, C, D, and E. So there's various causes for hepatitis A and E, and that could be, infected or contaminated water sources and food, whereas hepatitis B and C can be caused by infected blood and blood products that, somebody who doesn't use a clean syringe, needle, for injecting drug use, for example, can get hepatitis B or C, as well as HIV. Somebody who uses, unhygienic medical practice can also get the virus, hepatitis B or C. So yes, you are quite right. There are different causes of viral hepatitis. They cause inflammation to the liver, and they can actually lead to either an acute infection or a chronic infection, and a chronic infection can actually lead to liver cancer and death.
And of course, just looking at some of the symptoms, being fever, loss of appetite, diarrhea, nausea, abdominal discomfort, and dark-colored urine, amongst others. Maybe just tell us what are the most common symptoms that South Africans should be aware of. So
apart from the ones that you mentioned, abdominal pain, dark urine, and pale-colored stools, including jaundice, which is a yellow color of the eye and the skin. Those are the common symptoms that will lead somebody to seek medical help at a center. So those are things that people should be aware of. Also, our appeal is for people who are in high risk, practices, to just be aware that these viruses can be easily spread from individual to individual. Be aware of, the risks that are involved, and get tested.
And I mean, you stressing the issue around this being easily contagious. One would say that, when it comes to how can South Africans protect themselves, perhaps maybe just give us a bit of insight there, because it's such a contagious but, of course, treatable disease.
Yes, so with hepatitis A and E, one of the primary causes is, as I mentioned, contaminated water, food. Source of water is not the regular water supply in our piping systems. Raw sewage mixed with water. The virus can easily be spread from areas such as that. People going to the bathroom, not washing their hands, shaking somebody else's hand, can easily spread the virus from one person to the other. and eating food that's not, washed with clean water. Eating foods that not cooked properly can give you hepatitis E. So these are, some of the common causes of these, viruses for hepatitis A and E, and any, risk that can avert this, should be taken into account. So good hand hygiene is paramount in preventing hepatitis A and E. Drinking water from clean water sources, cooking food properly, boiling water, cleaning it, using bleach, etc. Using clean water is paramount to preventing hepatitis A and E. With regards to hepatitis B and C, I mentioned infected blood and blood products is the main source of infection. Just make sure that use clean needles and syringes as one way of preventing a spread of a disease like hepatitis A, B, and C. The other thing is people should get tested for hepatitis B because moms that are positive for Hep B can easily transmit the virus to their babies. So it's now in the national programs that all moms attending antenatal clinics should be tested for hepatitis B so that their babies can get the preventable measures, which is the hepatitis B birth dose at birth. Over and above that, hepatitis B and C can also be spread through sexual contact with partners who don't know their status. So definitely, taking precautions, just as with HIV, using condoms, knowing their status can prevent the spread of hepatitis B and C.
And just looking at your statement as well from the NICD, I mean, just looking at the records there from the 1st of April 2023 until March this year, at least 2,570 cases there being reported. Would you say that that's still alarmingly high?
So hepatitis A is, this speaks to hepatitis A. So hepatitis A is mostly an endemic disease in the country. It's usually acquired at a young age. The children are asymptomatic. They have an acute illness. They will get over it. The immune system is strong enough to help them get through the disease. But the most important thing is that they will have protective antibodies for the rest of their life. What concerns us about these cases is if the cases are in young adults and in older individuals. They're more symptomatic. They can have worse liver disease and worse, it can lead to fulminant hepatitis, for example, which is an exacerbated, liver disease and dysfunctioning of the liver. So we're trying to, actually prevent cases of Hep A in young adults and older individuals. But yes, as I said, the hepatitis A is endemic in the country. We are transitioning now to an intermediate phase where the young adults and older individuals are getting infected. And of course, we need to be aware of that.
Yeah. And of course, as we mark, World Hepatitis Day, what would you say as the NICD you are doing to ensure that, you continue to raise awareness and to educate the public when it comes to this disease?
So the NICD forms the surveillance platform for most of the diseases in the country, including viral hepatitis. We monitor the number of cases nationally so that we can, alert the province. We can alert districts as to where the number of cases are increasing. We can alert specific, key populations or, specific population groups if there's an increase in the number of cases. So we are, trying to enforce testing, treatment, and vaccination of individuals. Hepatitis C can be completely cured in 12 weeks of direct-acting antiviral therapy. It's a highly potent and robust therapy. It can cure an individual. If they are tested early, they can get treated and they can be cured. Hepatitis B, tenofovir, which is the drug of choice for HIV, can definitely be used for hepatitis B. And it can also, prevent transmission of Hep B because the number of hepatitis B virus particles can be reduced. Hepatitis A and E are symptomatic treatment. Individuals that have these infections can just monitor their levels of, hydration, and over a couple of weeks they will be able to get over these infections. With hepatitis A and E, the vaccines are available, so it is that if anybody is, particularly at risk for getting hepatitis A, for example, if they work in food restaurants, or in creches with children, etc., they should be vaccinated for hepatitis A. Hepatitis B, everybody, over the age of 20, under the age of 25, should be vaccinated for hepatitis B in the expanded program on immunization.
All right, Dr. Nishi, thank you so much for your time and, for elaborating there as the world commemorates and marks World Hepatitis Day. That's the head of Center for Vaccines and Immunology at NICD, Dr. Nishi Prabdial-Sing.